Good evening, everyone, and welcome to our Community Coalition event, COVID-19 Stories from the Frontline. We have an interesting lineup of guests today to continue with the conversations that began last month. I'd like to say that this is an initiative sponsored by Advocacy to Legacy, the Caribbean American Society of Hartford, the Cricket Hall of Fame, Jamaica Progressive League, the New England Grand Lodge, the Ukrainian National Home of Hartford, the West Indian Independence Celebration Committee, the West Indian Foundation, and the West Indian Social Club of Hartford. We are also pleased to partner with the Service Employees District 1199, which has played an outsized role in helping us to organize this event. Finally, we would like to thank our major sponsors, the Hartford Foundation for Public Giving and the City of Hartford. I am Dr. Fiona Vernal, Director of the Engage Public Oral and Community Histories Initiative at the University of Connecticut, and it is in this capacity that I am here to serve as the moderator tonight. Our panelists include Kadine Mitchell, who's the Executive Director of Brightview Senior Living. We will also hear from Pamela Radney, who's a CNA and now represents over 3,000 PCA. We may include a few other panelists as folks step in, and we would also like Mr. Lovan Collins from the Service Employees Union also to join us in this conversation. So welcome, everyone. Why don't we jump into the conversation? Ms. Mitchell, I'd like to have you start by presenting your keynote.
Absolutely. Thank you very much. Is everyone able to see the screen okay?
Yes.
All right. Thank you so much for having me again. I was really excited at our robust conversation and discussion we held at our last presentation. So I've tailored today's presentation to reflect more of the points that we wanted to dive deeper into and to represent exactly what we're topic, the stories from the front line. So I did receive the book and have been able to read a good portion of it. So thank you for that as well. So let's review the impact that we have as a people, as a culture, as the folks that we are representing today, specifically nationwide and within the state of Connecticut. So I wanted to look at a strength by numbers. So federally, nationwide, there are approximately 18 million healthcare workers. This includes all levels, from physicians to every aspect. Of this, we have 7 million that apply as direct care workers. I don't think it serves as any surprise to any of us that 81% of those 7 million serve as female. And the largest, most represented are women of color, specifically Black African Americans related to 25%. So we know that the majority represented are such. However, interestingly enough, we were discussing on our last presentation why providers are able to have varied protections for our associates and for anyone who were to get sick as far as short-term disability, whether or not they would have COVID pay, hazard pay. We weren't able to narrow down anything concretely from a federal standpoint. And the reason being is that the approved Families First Coronavirus Response Act, which was a relief bill passed in April, it actually exempt almost the majority of the 18 million healthcare workers. This results in the variation that we're seeing from nursing homes to assisted living from state to state on what providers can or cannot offer, including my own provider, which we mentioned some of the offerings that we received. Our company has since then leveraged the protections that they offer to highly encourage associates to get vaccinated. They were able to do so because of this variance. As a result of the largely overrepresented population of direct care workers, the CDC's report most recently as of December 2020, we're in a few months into 2020, we have reported almost 300,000 COVID-19 cases among healthcare workers and 928 deaths. And this is looking at direct healthcare workers. They do feel that this is not a full representation, as they do believe that employers have underrepresented because, as you may know, once it gets out in the media, this may be a poor reflection of their organization. Of those who have become ill, more than half have been workers of colors, primarily female workers. This is related to lack of access. A lot of people affected not having full, stable healthcare insurance, whether they'll be PRN and or part-time associates. And as a result, despairingly enough, we have the women of color most likely to be hospitalized, 52% healthcare workers. So there's a disproportionate amount of Black females that are receiving less care and having increased symptoms of COVID-19 as their counterparts. So if you look up stories from the front line, we talked a lot about that this is something that is now shifting away from the media. Believe it or not, I did almost a few days worth of searches, and I was able to find one article reflective of today's time. The majority of the published articles from NPR, New York Times, and other firmed reports have been from when the pandemic first hit. You are not alone. The stories that we feature in the Care Under COVID, there are several stories, but they were almost sensationalized to happen when COVID first hit. So we see lots of stories from March, April, May, and it's very few that we're able to find in today's time. A quote found from one of the articles on NPR News: "Many people don't believe that being a certified nursing assistant is a physically demanding job, but it is. Being a CNA is emotionally and mentally draining above all. It has become especially difficult with the emergence of the COVID-19 pandemic." I, for one, can attest to this, as my mother is a CNA and has been in her establishment for 38 years. She's celebrating 38 years, April the 6th. And so I have seen firsthand the demands of the pandemic on my own household and my own mother as she is trying to support the organization and her residents that she has grown so close to. What remains? We discussed a lot of points on our previous call, but I can think wholeheartedly we can say that the need is still great. Unless there's feedback differing from what I'm seeing in my own organization, hiring, staffing, openings, vacancies, shortages still remains. The need is still great within our skilled nursing communities, assisted living, home cares, and at this junction, they're reporting that the organizations that are profiting the most have been agencies that are able to outsource associates for care, for emergent care. So I did notice on the Department of Public Health website for Connecticut that they're allowing temporary nurses' aides. And this is something that is new to try to attempt to address the work increases and the staffing shortages related to the pandemic. Here in the state of Maryland, they have ceased licensing for med techs and CNA. So as long as you complete the online course, you are able to operate as such. And when they do begin to resume licensing, I'm sure there'll be a severe backlog of that. For some people, this may be comforting. To others, this may be something that is not, based on the potential skill level or testing of individuals that go to a class and not being fully licensed. We talked some about the vaccines and if we feel as if they are being administered on a large scale in the state of Connecticut. So on a national basis, we are seeing that they began in the United States December 14th. I shared that I received my second dose today. Our reporting is based on a completion of 2 doses. So to date, more than 75 million doses have been administered, reaching only 15% of the total US population. So 75 million sounds so significant, but in the grand scheme of things, it's not. And according to the CDC, we are administering 1.7 million shots per day. So let's take a look at how Connecticut is faring up. There were more specific details as to the number of constituents that have received their first dose. And this demonstration is showing that Connecticut is some of the few states that have been able to vaccinate over 18% of their population to receive 2 doses. They are at approximately 19.3. In the grand scheme of things, on a large scale, 19.3 may not seem like a lot, but it is somewhat comforting to see that Connecticut has taken the lead with few other limited states having reached that point. We're hoping to see more of these states reach the darker colors over the 18%. What we are seeing, we talked a lot about last week, well, what does this mean for us? What does this mean? Are we going to get more out of this? And what we are seeing as a result of more recent is that there's an increase in reporting. So at this moment in the state of Connecticut, the Department of Public Health is requiring a weekly report reflecting the number of cases and deaths related to both residents and staff. Currently, there are 213 skilled nursing homes that are reporting on a weekly basis. So this is a demonstration of all the reports that you can see. Once you select, you're actually able to see the organizations by name, the current census, the number of residents infected, as well as if you go through the second half, it breaks it down for associates separately, the staff impact. So we are seeing increased transparency there. The needs that remain, I think without a doubt, care under COVID, as well as everything that we have discussed, it is strongly to a place where we need to reassess the value of our essential workers and invest in a caring future. This needs to be done at a local level, a state level, and definitely at a national level. What remains is we're not having anything concrete, what we're seeing from the current administration just yet on the plans to impact the direct care worker. There are recommendations, but time will tell. And I think we all need to continue to watch very closely to see what will take place within the state and amongst the country to support the essential care worker. Thank you very much.
All right. Thank you. Thank you so much. We will now hear from Ms. Radway. Ms. Radney.
Hello, everyone. I'm Pam Radney. And thank you, Ms. Mitchell, for that first presentation. So I'm here to talk about the Frontline. And as you can see in Ms. Mitchell's report, healthcare workers has been overlooked, ignored, and yet we've been called essential workers, heroes, has not been treated as heroes. We only get in lip service. As a organizer working frontline with the Frontline PCAs, I'm getting everything from, I got COVID, how do I get help? We did have for up until January 1st, we was able to get 14 days of COVID pay, but that ran out when the new year came in. I had a PCA who was working with an agency who caught COVID, making $12 and some change. And now for the rest of her life, she's 39. She has to wear oxygen from now on. And she asked herself, was $12.35 worth losing air in my life? And no. And yet and still, when we call for raises, call for health insurance, which she did not have, this is too much money. So where is the value in the work that we're doing? We're truly on the bottom, but whatever's on the bottom is holding everything up. Remove the bottom, the top fall. So how do we get the folks in charge to understand if you take care of the essential workers, it will fall into place. We have PCAs who are now homeless because their consumer was very afraid of them coming in their house to maybe bring COVID in. So they told them that they didn't want them to come. So as our program works, it works like this. PCAs go into the home. So it's usually just that PCA in the home taking care of that individual. Now, the individual can have anything between fully functional, they can talk, they can move, but they have some sort of handicap where they need assistance for cooking or something like that. Then you have some who is bedbound, who need Hoyer lift, who have to be toileted. It range. And so it is hands-on. There's no subs. If I can't come in, then that person is left alone. And so to me, this work is very valuable to the folks who are receiving the care. And when we have a system that doesn't value you as a worker, when you still go to work regardless, but then when the consumer says, I don't need you because I'm scared to get COVID, what do the worker do? So they end up some homeless, some try to apply for unemployment. And even that was tough because they wasn't let go. They was just like, don't come. So, unemployment is, you have to say specific words in order to qualify. So it has been, for frontline workers, it has been literally living through two different crises. And as Ms. Mitchell mentioned, the majority of PCAs are women of color. And it always has been that way. We was 7 years ago, PCAs was invisible. No one knew who we was. No one knew the work that we was doing. So we just came above the water. We just got visual, and then the pandemic hit. We was not supplied with PPE, which is very essential for the work that we're doing. We had to send thousands of emails to the commissioner, to the government. We had to make millions of phone calls to representatives to say, hello, why can't we have PPE? And, a lot of it was like a go buy it. We're making $16.25 an hour, and some is at 15. Now you have to supply your own self with masks and gloves, which is not in the budget. When you're working from job to job. And some PCAs have 3 jobs that they're working with 3 different clients. And those was the ones who was let go first because clients could not afford them going from one house to another house and not knowing. We had a couple of PCAs who went home and gave the corona to a parent. And, so far, the PCAs, no one died, but it was critical. I know in nursing homes, some have died, some parents have died. So when you say frontline workers, what does that mean? Why now that the teachers is just now going for the vaccine? How do we have these conversations? And it's good to get out, but how do we make them understand that if you say we are central, that means we first line, we should be up first. The shots should have went to all healthcare workers, from PCAs all the way up to doctors. And half of our PCAs still haven't got vaccinated. Why? The system, you go online, you have to register, and then when you register, when you go to the site, they don't have you there. So then you're there again, literally crying to get a shot. And some places will say, okay, we're going to go ahead and give you a shot. But we was never on a specific list. Like, here is your time to come. So my question Why do PCAs still go to work every day? Is it because they need the job or they love the job? And if you ask a PCA, why do they still go to work? It is because they love the job. They cannot leave their consumer unattended because that is all they have. If I don't show up, my client don't eat. If I don't show up, my consumer client don't get out of bed. If I don't show up, then my consumer is confined to one space for that day until someone else come on a second shift, or if there is a second shift. So a lot of folks don't realize how much work a PCA put in, and the fact that we was totally ignored when the pandemic hit. Totally ignored. If we wasn't an organized group like we wasn't 7 years ago, I myself worked as a PCA part-time for 14 years, and I could never understood why no one knew what my job was. That's how secret we were. So now we're here, and everyone understands that PCAs need to be not just called heroes, but shown that they are heroes. And they need to have access to everything that other folks have access to. And we had one PCA who had just had a baby, was out on maternity leave, came right back to work, and then the agency who pays us wasn't paying her. And then the pandemic hit. So here's a person with a newborn in a pandemic, didn't get paid, then the pandemic hit, now she's crying, how do I feed my kid? And it's, what do we do? So I'm sure it's a lot of stories out here, it's a lot of things, but PCAs are being ignored, and yet we hear we are heroes, but we do not see it in any aspect of anything that we're doing, but we still get up and go to work every day despite COVID-19.
Thank you, Ms. Radney, for sharing that. Mr. Williams? Mr. Lincoln Williams, will you be able to share your story with us?
Hi, good evening, everyone. My name is Lincoln Williams. I work with Trinity Hill Nursing Home for, it's 10 years now. It's going 10 years. As some people might know, some might not know, that we have, since the epidemic had come in, we had some people that come together and write a book. Everybody write a little article, and the name of the book is My COVID Experience. That's my, and yeah, that's the title of the book. My title is My COVID Experience, but the book, the name of the book is Care Under COVID. And I just say a warm welcome again to everybody, and a good evening another time. Yes, my experience with the nursing home that I work with, it's something that you have to love for you to be doing it. Many things is not right. One of the things is we work so hard, and what we really want for our pay, we're not getting it at this moment, because we're just getting a little over $16. Some might not reach that stage yet. Some still getting 15, and you know, the type of things that we have to go through. And, you know, as I said, it's because of the love of it why we really do it. It's not for the money, because if it was for the money, many of us would quit long ago. One more thing is we have to be together. We have to come together, work together for the good and for the care of the resident, because, you know, unity is strength, and that is how we get strength, when we work together. I am a survivor from COVID. I got it in last year, April, somewhere there, yeah. And I had to, after quarantine for 3 weeks, I ended up have to go to the hospital, shortness of breath. When I get there, they realize that I have pneumonia also, and I was treated there, spent 3 nights in the hospital, have a big bill to pay between the hospital and the ambulance. So it's not anything easy. It's a bad experience, but thank God I'm alive. Sorry for those who didn't make it, their families and all of that. And sad to know that I got it from one of my patients that I was working with. I didn't know that he had it, and after dealing with him, you know, I just know that he has a bad cough on his stomach, and I end up telling the nurse about it. I said, the patient, I realized he coughing, not like how he used to. It's, you know, something congesting, because he could hear it on his stomach or his chest, whatever we call it. And we gave him some medicine for it, and like 2 days after, you know, he get worse. They sent him to the hospital, and only to find out the result came back, he is positive. Since he had cough on me, I realized, so well, if he cough on me, I have to get myself checked out. And I did so, and I got it too, because the result came back positive. And from there, you know, quarantine and taking medicine, all of that, until we reached to where I was, you know, and it's one thing after another. And, you know, we managed, by the help of God, to be here today. My advice to each and every one who don't take the vaccine yet, I took mine. I don't know who else want to take it, but I took it. And we have to use precaution. Wear our masks 6 feet apart, social distance, wash hands, don't put your hand in your face. Try to be as clean as possible as you can, because that's the only way out. We can survive it. I'm just gonna read maybe two lines of the article that I write. My COVID experience. My name is Lincoln Williams, Trinity Hill Care Center, Hartford. I have been a certified assistant for 9 years at the time, while I was at work in March of one of my patients was coughing heavily. I said to the nurse, my patient sounds like he had a bad cold. Could you give him some medicine for it? So she gave him some over-the-counter cough syrup. The next day when I went back to work, I saw that he was still coughing. I told the nurse that I was gonna take him out of bed and put him in his motorized wheelchair. But he was coughing so bad, laying down. I felt he would be more comfortable sitting up. I told the nurse that I was concerned he might have pneumonia. So many of the patients were quarantined and not allowed to leave their room. At some point, the patient coughed right in my face. I washed my face, but it seems it was too late. If he had the virus, I've been exposed. Toward the end of my shift, I put the resident to bed and I went home. And later on that night, I heard that my patient was not feeling well. They sent him to the hospital. Then 2 days after, the hospital sent back the report that he was COVID positive. Later in that week, I heard that he had passed. So this COVID is no joke. It is serious, and we have to know what we are doing. Let us be more concerned. Let us think of each other. You think of me, I think of you. And let us pull through the best way we can. Back to you, ma'am.
Thank you. Thank you so much, Mr. Williams, for outlining the devastating loss of your patients and your patient and client, and the risks that you have to face every day in trying to care for them. Thank you to Ms. Williams and Ms. Radney for outlining for us the feminization and racialization of care work and the gap between the rhetoric of being essential valued workers in a system that does not actually reflect the kind of attention in the same way for your worth and your value and the daily risks that you guys face. We now are going to open up the floor to questions. I wonder if the panelists could give us a sense of where they are now, a year into the pandemic. We're almost at this terrible anniversary of the country shutting down in March, and here we are a year later. Ms. Radney?
Yes, so for PCAs, it's so normal that to go to work every day. I think it's more like they're not even thinking about where we are a year coming up. And I survived knowing we're still not out of danger, but feeling like we got through the tough part and now it's uphill for better now. And then now we're facing the fact that we need health insurance. I think if anything came out of this, it was awareness of not having health insurance, not being able to go to the doctor when you feel sick or you get a cough, you try to fight it at home alone. I know for myself, I also got COVID. And when I was supposed to go to the hospital, my biggest fear was going to the hospital and catching COVID, not knowing that I already caught it. So, worried about a bill, and like Mr. Williams saying, going in the ambulance, that's another extra on top of what you're going to get. So the awareness now is, how do we have sufficient health insurance so that burden wouldn't be so heavy and we can actually live a healthier life.
Thank you, Ms. Radney. Ms. Mitchell?
So going into it a full year, my organization's focus is the road to mental well-being, because I think naturally we as a people can go through a challenge and trauma at a high pace for a shortened amount of time, but this is very elongated. So we are seeing people extremely fatigued, extremely tired, not just because of the abundance of work that they're doing, but just the extended amount of time that they've been without their loved ones. I know my family alone, we are, struggling with not being able to travel as much to our areas to see our loved ones, to see them in person. So people are getting fatigued from just not being able to do their normal routine. In our area, children are just going back to school today and at 2 days a week. I know that Connecticut has done some of that. So the children are fatigued. So we're just seeing that the long road is getting to a place that we have to acknowledge it's okay to not be okay, allow people that space and that outlet, and then really work towards being able to get through. Because even though we're here at a place where we're looking at the vaccine, we're still seeing that 15% of the United States is vaccinated, and it's going to be a while before we get to the projected 40 to 60%. What does that mean? It doesn't mean because we're vaccinated, we won't be able to pass it and or get it. So we're still not out of the woods yet. And for myself, it takes a lot of inner work. It takes a lot of just inner peace, praying, because I definitely see this as something that we're going to be tackling and within until 2022. If not beyond. Thank you.
Mr. Williams, how are you doing a year in? If you could unmute at the bottom of the screen, if you could hover and unmute, Mr. Williams. Yes.
And your question is?
How are you doing 1 year later?
1 year later? I'm doing much better. You have obstacles, bumps, but with God you can make it. You just have to think of things that you are doing, to regroup and move forward.
Thank you. Mr. Collins, can you give us a sense of what this pandemic, where we are in this pandemic a year later, what it means for organizing and legislative priorities?
Oh, thank you. I just want to kind of speak back to a point that was made that I think is very important from a community perspective. And it dragged me back to a conversation I had recently with a friend of mine. Out of the blue, his dad is in a convalescent home, which I'm familiar with, but wasn't familiar with the situation. And he has not seen him in a year. So I just say that to state that the pandemic really changes relationships in more ways than one. And being that we're speaking about frontline caregivers, and that also includes the impact of the residents. So I'm looking at this as a community alliance and this a pandemic that has affected our community as a whole. And moving forward, we've been through a lot in a year, and we've waited a year for a vaccine, and during which people's own strength, people resorted and had conversations with me, frontline caregivers, of coping and how they would cope with basic things as make some of the little things that we do take for granted for tea, maybe garlic, ginger, and these little things. So I'm referring to these things as self-help and ways how we move forward as a people. So we're at a point where everyone seems to be clasping their fingers, hoping that there is a big legislative fix or a big fix from some big company or something. But I just want to point out that the state of Connecticut has put out its budget within the past few weeks, and it did not reflect any such increases to even address some of the issues that frontline caregivers have borne with over the past year. And that is unfortunate. But what is fortunate is that that opens a door for dialogue between the community and the representatives of the community. And a lot of the communications now are on Zoom, so representatives don't even know what's going on. I believe this call has put us in a place to understand what our community is going through, bearing the fact that in the home care, which Pam spoke about, that provides a lot of jobs for our community, in the convalescent homes as well, hospitals, the healthcare field in general. And out of that, our community grocery shops benefit, everything. I don't have to go into that. So what I'm saying is we're at the point where the budget, this is the critical point that will determine if we are heroes or zeros. So the budget does not reflect anything of the sort that would provide the kind of lifestyle appreciative change that Mr. Williams spoke about, and as well as Pamela spoke about. So it is a point where it's either we leave it up to them or we engage as a community. And I think it's a make or break point where these stories have to be told, and in the outcome, something has to be done. But what will be done, it is proven that cannot just be left to the higher ups to do the right thing without accountability and communication. So to wrap it up, the union and its members have demanded that this kind of work should be done for no less than $20 an hour. And that is very necessary to hire in the field, because nobody is going to work in a convalescent home right now because the minimum wage has risen close to what the starting rates are, and it has to be addressed so that the proper care can be provided in these settings.
Thank you. Thank you for that. To any of the panelists who would like to answer, do you think the pandemic has opened up a space specifically in the Caribbean community to have a different conversation, one that was difficult before, a different conversation about mental health?
Yes.
Mr. Williams, you want to give us some insight?
Yes, are you hearing me?
Yes.
Yes, it has opened a way of said, a way of speak right now because of what is happening. You know, because this thing has took us by surprise. You know, when you look at churches shut down, most business place, it make you question yourself, what is going on. So yes, it has opened a wide area, and if we're not mindful or careful of what is going on, we're gonna be caught up and we're gonna lose. So, it's a way now for each and everyone to understand and help each other as we go by.
Thank you. Does anyone else want to jump in on, yes, Ms. Radney?
Yes, in the beginning, I was overwhelmed with so many phone calls and so many people going through so much, and it took effect on me. And I actually, got sick, not with COVID that time, but just like got high blood pressure, everything. And what was needed was me to have an outlet to go and talk about what was happening to me, but because of being raised in the Black community, that was not something you don't do. You a strong Black woman, you can deal with it. Deal with it. Take a pill, go to sleep, wake up, and deal with it. But I couldn't deal with it. It was overwhelming. It was just like I needed an outlet. So, we have resources that I never took advantage of, but I called because I felt like I wanted to go into a room and shut the door and don't come back out. And that's not me. I am such a social butterfly. So I knew that I needed to talk to someone. And so this pandemic had opened up so many people to say it is okay to get help. It is okay to talk about it to someone else other than, your significant other. And I think, despite this pandemic being bad, a lot of good things came out of it. A lot of awareness. It's no more my story, right? It's all of our story. It's no more at my back door. It's at everyone's back door. So when we see a group fighting for something, stop, get out, help, make some noise too, because this is going to take all of us to fight this, to get the right legislation in place so that people can have a decent living, have health insurance. It is no more one person problem. It is all of our problems. So yes, this definitely opened up a lot of doors for people to see it is not one person problem. It's the community problem.
Sorry, now I'm on mute. Ms. Mitchell and anyone else who has something to contribute, can you talk a little bit about the emotional and mental state of the residents, especially those who haven't been able to have visits from their family members or have had very limited visits from their family members?
Absolutely. We have to take into consideration that our generation is very, very familiar with technology and able to pick up the phone and do a FaceTime, WhatsApp call and see our loved ones, even if it's at a distance. And a lot of our residents have been able to get introduced to that, but with assistance. So that's still very limited. So our residents are definitely feeling it. We have seen residents, their demeanor have changed, weight loss, COVID-19 delirium is at a rise. People that had signs of dementia, it has definitely progressed much faster than it would have non-COVID, just because a lot of their sunshine and a lot of their day was with their family members, and especially family members that visited our residents in our memory care neighborhood. So it really took a lot of creativity, and I think we spent more time doing FaceTimes than we did doing sometimes actual care, just to hear the voices of their loved ones. And a lot of our family members, believe it or not, even when we did say, okay, let's invite you in, they were just as scared to get COVID-19 themselves. So they were saying, I'm not ready to come in and visit. And so we have definitely seen that. I myself have lost 2 residents, thankfully, 2 out of over 100 in this entire year period, but 2 is still too many. And one of my residents, her spouse is still remaining, and he is in a deep, deep state of depression after 65 years of marriage and not have expected to lose his wife as such. So I think to also tie into the previous question, absolutely, this is opening up a conversation for mental health, because it's not just limited to affecting a certain group of people. I think a certain group of people are getting more largely affected, but even quote unquote our bigwigs, some of them have had losses to COVID-19, and they have older parents and they have loved ones that they haven't seen. And they're also tired because they have people knocking on their door saying you have to meet certain numbers. And so there's different variables of the strain that we're all feeling from COVID-19, but I think at some level, there is definitely a consistent conversation that we need to address the mental well-being of people who mean well, who are passionate to do what they do, because burnout is real. And to sustain through this, despite for the protection of your own family and your work professional family, will take some endurance for sure.
Thank you for that overview. And then finally, very briefly, maybe a phrase or one sentence. Are there any distinct skill sets, points of views, perspectives that the Caribbean community has or brings in terms of its cultural orientation that can be leveraged as a resource for people to help themselves while we're waiting for state and federal officials to get their acts together?
I would chime in to say continue to lean on one another, to continue to have these discussions and have an outlet for people. Continue to check in on your strong friends. I think Ms. Radney said it earlier. She was raised to believe that she can handle it all. And sometimes our strongest friends are the ones that we need to call and just say, hey, are you okay? I know you're not. Let's talk about it. And so coming together, Mr. Williams said it best as well, unity in numbers and in strength, coming together and supporting one another. And as a family, supporting the children as a group, supporting the elders as a group, as a community, we can get through it together. There still will be times that I'm sure we'll still feel alone, but together is much better than by yourself.
Any ideas, Ms. Radway? Ms. Radney?
Get involved. Get out. Put your boots on the ground. Let folks know we're not going to sit in our kitchen and discuss this. We're getting out on the road and making it happen. I just think that's our strongest point right now, is we have to go back. Your parents say, go back to the old times. And that's what they did. Okay, they got out there and made some noise and changes, because we're not going to solve it inside. You have to get out. So when you see a rally, you will see one next Wednesday on the 10th. Stop, get out, yell with us, because this is our only way right now. We have no other way.
All right. Thank you so much. I really appreciate the perspectives that all of you have provided today.